Welcome to the American Institute of Healthcare Compliance Compliance Tip, what you need to know about Modifier 25. This session is for coders and billers, and the content in this compliance tip should not be considered as legal or consulting advice. The AMA's CPT Modifier 25 states that it is for a significantly separately identifiable E&M service or evaluation and management by the same physician or other qualified healthcare professional on the same day of the procedure or other service. Now, Modifier 25 is used to gain reimbursement when you are doing an evaluation and management and then a decision to provide an additional service that is separate from the E&M is warranted. It's always appended to the E&M. Never append Modifier 25 to anything other than an E&M service. It's a red flag to the payer that you don't know what you're doing and it can cause a problem with your reimbursement. Now let's talk about what Medicare says about same physician. Medicare defines same physician as providers in the same group practice of the same specialty. And when this happens, they must bill and be paid as though they were a single provider. You don't have to have a different diagnosis for each line item for the E&M and then for the additional services. Now, it could be that you have the same diagnosis or you can have different diagnoses. We're going to go through some examples in just a moment. For instance, the patient may be returning to the clinic for a recheck and refill for blood pressure medication. And then the patient complains to the provider about a little bump which has been irritated. The doctor decides at that time to do a biopsy, and also a decision is made to get a vaccine for pneumonia and flu. Modifier 25 would be appended to the E&M, reporting the conditions evaluated for the bump and for the blood pressure. And a biopsy code would be used to report the biopsy of the lesion, and then you would report the appropriate ICD-10-CM code for the lesion, and then you would use Z23 diagnosis code for the immunization administration and drug charges. Now, there's often questions that are posed regarding whether to bill E&M on the same day as a procedure or other services and appending Modifier 25. So the questions and answers that we're about to go over in this presentation are from Medicare MACs, the Medicare Administrative Contractors, and primarily from Novitas. So the first question is, should I use Modifier 25 to report an encounter resulting in decision to perform surgery? Well, don't confuse Modifier 25 with Modifier 57. So you have to ask yourself, why is the patient being seen? And is the modifier, how are you using it? This modifier is not used to report E&Ms that are result in a decision to perform surgery. So you need to take a look at Modifier 57 definitions, and we'll also have a YouTube video for that modifier as well. And you need to take a look, would it be a Modifier 59? So you need to take a look which modifier is going to fit best. Another question, are there signs, symptoms, and or conditions the physician or the other qualified healthcare professional must address before deciding to perform a procedure or service? And the answer is yes, based on documentation. The E&M service might be medically necessary with Modifier 25. So let's look at this example. This would be a 99213, Modifier 25, and 20520 when an established patient is scheduled for a follow-up and the physician meets all the bullets and criteria for a 99213. Patient then complained that they're washing dishes, dropped a glass, and now his thigh muscle feels like it has a piece of glass that's gone through the skin. Based on the signs and symptoms that are documented, the physician decides to perform a removal of a foreign body, and that has a global of 10 days. So you would bill that 99213 and a 20520. Should we append Modifier 25 when the provider's E&M of the problem is significant and beyond the normal pre- and or post-op work? Well, the answer is yes, when documentation supports it, of course. An example would be an established patient sustained a severe laceration to the scalp. Before suturing the laceration, the physician performed and documented a comprehensive history and exam to determine if the patient sustained neurological damage. The physician then performs a 3.0 centimeter intermediate repair, which is reported with code 12032 to the scalp. Now, based on the signs and symptoms and conditions that are documented in the record, the physician went above and beyond the normal preoperative work. The proper billing would be 99215-25 modifier and 10232. Can we use modifier 25 when there are one or more diagnoses present that are being addressed and are affecting the treatment and outcome? We went over this a couple slides ago. I want to go over it again because this is a different type of scenario, and this can be confusing, and this is where we don't want to make mistakes. So the answer is yes. Bill the E&M with modifier 25 when there's documentation to substantiate the use of the modifier. So let's say an established patient comes in to see the internist for a follow-up with hypertension and diabetes. The patient also complains of shoulder pain. Physician performs a problem-focused history and exam, evaluates the patient's hypertension, and determines the blood pressure was higher than usual and adjusts the medication. The patient's glucose level was normal. The physician also evaluated the shoulder and determined the patient would benefit from an arthrocentesis. The physician evaluated the shoulder before performing the arthrocentesis, but also evaluated other problems, the hypertension and diabetes too. So based on that documentation, billing the E&M and the procedure on the same day with a modifier 25 would be appropriate. We have to remember not to misuse modifier 25 because it's used to help get paid for additional services instead of having them bundled together. So, was the procedure or service scheduled before the encounter? And if the answer is yes, then we really need to look to see if we can bill the E&M at all. A patient, let's say, was scheduled to have a lesion removed from her right leg today, but this decision was made prior to today. So the doctor said, okay, I'm seeing you today for other issues. I want you to come back and reschedule time when I can remove that lesion to your right leg. So the patient returns on a different day. The physician examined the lesion, infiltrated it with lidocaine. The lesion was removed and a simple closure, which is 11401. In this case, you don't bill E&M. Modifier 25 is only appended to E&M, so you'd only bill 11401 because the decision that this service was needed has already been performed and you don't want to double bill it. Another question is modifier 25 reported on the second encounter if a physician sees a patient in the office in the morning and then again in the afternoon for a new or worsened condition. And Medicare says no. Most payers are going to say no. You combine everything that you did for the patient in the one day. Modifier 25 is going to be used to identify something significantly and separately identifiable performed by a provider on the same date as a procedure or other service. Medicare and most other payers are not going to expect to see two E&Ms reported on the same date on a routine basis. The physician is going to be expected to combine the documentation and only bill one E&M. What about code 99211? That's for an established patient nurse visit. Can you append modifier 25? And the answer is no. It is not appropriate to append modifier 25 to a nurse visit code. And according to CMS, it's appropriate to append modifier 25 when the modifier indicates that it was a separately identifiable service that was performed that meets a higher level of complexity of care than you would represent with code 99211. Now, to look at this whole thing and follow Medicare guidelines or follow payer guidelines, you can look at reference CMS publication 100-04, the Claims Processing Manual, Chapter 12, Section 30.6.6. I hope you enjoyed today's compliance tip. Visit our website, aihc-assn.org, or call us if you have questions.